Okay, here we are with Eldon. And Eldon, you've been a patient in our office for a few months now. And could you share with us some of the things that you were challenged with your health, and maybe go a little bit into your health history?
Sure. In my mid-30s, I injured my right leg, and for decades now I've not been able to feel the front of that leg. About 6 years ago, I had back surgery, kyphoplasty, which I don't think was done correctly, and I've suffered varied levels of pain ever since then. I had scoliosis as a child, which wasn't discovered until about 20 years ago, so my posture and my neck and back pain were always prevalent. Fall of 2009, I was diagnosed with breast cancer and went through a complete mastectomy with chemo radiation, and also with...
Okay. All right, very good.
I'm free.
Okay, and so as a result of these challenges, what you're telling us is that you had chronic pain, correct?
Yes.
Chronic pain and numbness, and also you mentioned that you had a lot of brain fog too, like you just, it's hard to think and concentrate. Is that correct?
Yes, that started and continued basically up until the last couple of months, right through the radiation and the chemotherapy.
Okay, very good. And how would these things affect you on a daily basis?
Oh, my whole life was turned upside down. It seems now that, or up until recently, that everything would take 5 times as long to do. I would be forgetful. I would have to start making lists. The pain that I was experiencing just slowed me up as far as the fatigue was concerned, but also the mental attitude, where I would tend to resolve into a depression and not
get things done.
Right, not do the simplest of things.
Good. And different activities that you would normally do would be quite painful, and you'd have to, pace yourself and take breaks and things like this to get just routine things done.
Yes, things as simple as walking any distance.
Okay, very good.
I'd have to do in sections.
Very good. And since you've been a patient in our office, how is that all different now?
Okay, let's start from the bottom up. My right leg, I've started to be able to get some sensation back into that. Walking as I did just recently, a couple of miles, I can feel my leg now, whereas I couldn't before. I've had friends tell me, long-time friends now, that my posture is a lot better. My range of movement is a lot better. I am being able to walk distances and exercise and exert myself for much longer periods of time. 9 months ago, my friend said, for one day I spent half the time in his van as opposed to walking. I was basically sleeping. My sleep patterns are becoming more regular. The sleep length of periods of sleep is being reduced. I'm not needing that 4-hour nap now in the afternoon.
Okay.
Trying to think.
And the overall back pain is greatly reduced.
Yes.
So you're much more mobile. You can get things done quicker.
Correct. Yes. Not quick, but better.
A lot better.
Oh yes.
A lot better.
Yes.
And tell us about like your ability to focus, memory, and like just mental clarity. How has that improved?
I used to go through every day with what they call chemo brain, which is basically you entered and stayed in the whole day in this fog. I still occasionally get that, but that's the exception. Everything now is a lot clearer. I'm able to focus on things that I want to do and things that I have to do.
Okay. With all these changes that have occurred from the care office, could you just give us kind of a summary of like how it's made life easier, how it's improved your life and well-being?
Oh, I think my depression attitude is being greatly reduced. I'm now focusing on a day where I'm determined I can and will get things done. And I have the ability now to be able to do that, which I did not a few months ago.
Mm-hmm. Okay, very good. And overall mobility is quite improved also.
Yes, and this is commented on, as I say, long-time friends who haven't seen me in 9 months, who I think sort of amazed to see that I had that amount of...
Right, how much better you are.
Yes.
Very good,
Yes.
excellent. And Eldon, would you recommend other people who have health problems consult our office?
Yes, certainly. From what I've experienced in the last 3 months, it's nothing but positive.
Very good. Thanks so much.
You're welcome.